Reflux in babies is a common condition that often causes concern for new parents. At its core, reflux occurs when the contents of a baby's stomach come back up into their esophagus and sometimes even into their mouth. Imagine a baby drinking milk. Instead of staying down in the stomach, the milk, along with stomach acids, can make a return trip, leading to spitting up or even vomiting. So, why does this happen? Well, babies have a muscle at the entrance of their stomach called the lower esophageal sphincter. This muscle is like a door that's supposed to close after food goes into the stomach. In babies, this door isn't fully developed yet, so it doesn't always close properly. This allows stomach contents to flow back up, causing reflux. Types of reflux in babies. There are two primary types of reflux in babies: gastroesophageal reflux and gastroesophageal reflux disease, or GERD. Understanding the difference between these two is crucial for recognizing when a baby might need medical attention. Number 1. Gastroesophageal reflux. Gastroesophageal reflux, or GER, is incredibly common in infants, especially in the first few months of life. It's estimated that up to 50% of babies experience some form of reflux, with most cases occurring in babies between 2 to 4 months old. Babies with GER may spit up regularly after feedings, but they generally remain happy and healthy otherwise. For the majority of these infants, reflux is a normal physiological process that doesn't cause any significant problems and resolves as they grow older. As the baby's digestive system matures, the frequency of reflux episodes usually decreases. By the time most babies reach their first birthday, they have outgrown reflux altogether. Number 2. Gastroesophageal reflux disease. Gastroesophageal reflux disease, or GERD, is a more severe and persistent form of reflux. It is less common, but still affects a notable percentage of infants. It's estimated that about 1 in 300 babies may develop GERD. This type can cause more significant discomfort and can lead to complications if left untreated. Babies with GERD may experience more frequent and forceful vomiting, irritability during or after feedings, and difficulty gaining weight. Unlike GER, GERD can cause damage to the esophagus due to the frequent exposure to stomach acid. This condition often requires medical intervention and close monitoring to prevent long-term complications. Causes of reflux in babies. The causes of reflux in babies are primarily related to the immaturity of their digestive system. When a baby is born, their digestive tract is still developing. So, the lower esophageal sphincter, which is the muscle responsible for keeping stomach contents from flowing back into the esophagus, is not yet fully functional. In infants, the LES is often weak or may relax at inappropriate times, leading to reflux. Another contributing factor is the liquid diet that babies primarily consume. Milk, whether breast milk or formula, is a thin liquid that can easily flow back up into the esophagus if the LES doesn't close properly. The frequent feedings that newborns require can also contribute to the likelihood of reflux episodes. The more often a baby is fed, the more opportunities there are for the stomach contents to be pushed back up. Additionally, a baby's position can play a role in reflux. Babies spend a lot of time lying down, whether in a crib or in a parent's arms. This horizontal position can make it easier for stomach contents to flow back into the esophagus, particularly after a feeding. Gravity helps keep stomach contents down, so when a baby is lying flat, it's easier for the milk and stomach acids to travel back up. The size of a baby's stomach is another factor to consider. Newborns have very small stomachs that can only hold a small amount of food at a time. When a baby drinks too much milk at once, their stomach can become overfilled, increasing the pressure on the LES and making it more likely that some of the contents will reflux. Some babies are also born with certain conditions that can increase their risk of reflux. For example, premature babies often have underdeveloped digestive systems, which can lead to more frequent reflux episodes. Babies with certain neurological conditions may also have problems with the muscles involved in swallowing and digestion, making them more prone to reflux. In some cases, food sensitivities or allergies can contribute to reflux. For example, cow's milk protein allergy is a known cause of reflux in some infants. In these cases, modifying the baby's diet or the mother's diet, if breastfeeding, can help reduce reflux symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of reflux in babies. The symptoms of reflux in babies can vary widely depending on the severity of the condition and whether it is GER or GERD. In mild cases, the symptoms are often limited to frequent spitting up, which is typically more of an inconvenience than a medical concern. This spitting up usually occurs shortly after feeding and can range from small amounts to more significant quantities of milk or formula. Parents may notice that their baby spits up more when they are lying down, especially after a large feeding. In addition to spitting up, babies with reflux may exhibit other signs of discomfort. They might become fussy or irritable during or after feedings, as the acid and stomach contents that come back up can cause a burning sensation in the esophagus. This discomfort can make feeding time stressful for both the baby and the parents. Babies with reflux may also have difficulty feeding, as they may refuse the breast or bottle, arch their back, or cry during feedings. Some babies with reflux may experience more severe symptoms that suggest GERD. These can include frequent and forceful vomiting, where the contents of the stomach are expelled with significant force. Unlike simple spitting up, this vomiting can be distressing and may result in poor weight gain if the baby is unable to keep enough food down. Babies with GERD may also have trouble sleeping due to the discomfort caused by reflux. They might wake up frequently, crying or showing signs of pain, particularly if they are lying flat. Some babies with GERD may also experience respiratory symptoms, such as coughing, wheezing, or recurrent episodes of pneumonia. This is because the stomach acid can sometimes be aspirated into the lungs, leading to irritation and infection. Another symptom that can be associated with reflux, particularly GERD, is the presence of blood in the vomit or stool. This can occur if the lining of the esophagus becomes irritated or inflamed from the frequent exposure to stomach acid. While this symptom is less common, it is a cause for concern and requires immediate medical attention. Diagnosis of reflux in babies. Diagnosing reflux in babies typically begins with a thorough discussion of the baby's symptoms and medical history. Your doctor will ask about the frequency and severity of spitting up, vomiting, and any other related symptoms. They will also inquire about feeding habits, such as how often the baby is fed, how much they eat, and whether there are any signs of discomfort during or after feedings. In many cases, a diagnosis of reflux, particularly GER, can be made based on the symptoms alone. Since GER is so common in infants and usually resolves on its own, doctors often rely on parental reports and clinical observation to make the diagnosis. If the symptoms are mild and the baby is thriving, further testing may not be necessary. However, if the symptoms are severe, persistent, or suggest GERD, additional tests may be needed to confirm the diagnosis and rule out other conditions. One common diagnostic test is an upper GI series, also known as a barium swallow. In this test, the baby drinks a liquid containing barium, which is a substance that coats the lining of the esophagus and stomach. X-rays are then taken to track the movement of the barium through the digestive tract. This test can help identify any anatomical abnormalities, such as a hiatal hernia, that might be contributing to the reflux. Another diagnostic tool is esophageal pH monitoring. This test measures the acidity in the esophagus over a 24-hour period. A small tube is inserted through the baby's nose and down into the esophagus, where it remains for the duration of the test to see how often reflux occurs. In rare cases, a doctor might recommend endoscopy, where a tiny camera is used to look inside the baby's digestive tract. Treatment for reflux in babies. For most babies with GER, treatment is focused on managing symptoms and providing comfort, as the condition usually resolves on its own as the baby grows. Parents can take several steps at home to help reduce the frequency and severity of reflux episodes. One of the most effective ways to manage reflux is by adjusting feeding practices. Smaller, more frequent feedings can help prevent the stomach from becoming overfilled, reducing the likelihood of reflux. Keeping the baby in an upright position during and after feedings can also help, Some parents find that thickening the baby's milk with a small amount of infant cereal can help reduce reflux. This makes the milk heavier and less likely to come back up. However, this should only be done under the guidance of a doctor. If lifestyle changes and feeding adjustments aren't enough to manage the symptoms, a doctor may recommend medication. The most common medications used to treat reflux in babies are acid blockers and acid suppressors. These medications reduce the amount of acid produced in the stomach, which can help reduce the discomfort associated with reflux and prevent damage to the esophagus. Commonly used medications include H2 blockers, such as ranitidine or famotidine, and proton pump inhibitors, like omeprazole or lansoprazole. It's important to note that these medications should only be used under the guidance of a healthcare provider, as they can have side effects and may not be appropriate for all babies. In more severe cases, particularly when GERD is diagnosed, surgery may be considered. One surgical option is called fundoplication, where the top part of the stomach is wrapped around the lower esophagus to strengthen the LES and prevent reflux. This procedure is usually reserved for cases where other treatments have failed and the baby is experiencing significant complications from reflux, such as poor weight gain or respiratory problems. While surgery can be effective, it is typically considered a last resort after all other options have been exhausted. Now, we want to hear from you. Has your baby experienced reflux? What tips or remedies have worked best for you in managing their symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.